throw these away every 24 hours. You're supposed to. The roller doesn't. VA does. Huh? Yes, VA will. They're really good at disposing this every 24 hours, but a lot of times other facilities are not. So on the PEG tube, it's the same. It's a lot similar to the NG tube. It can go into the stomach. It can go to the jejunum, duodenum, anywhere in the small intestines for feeding. You're going to, again, listen to bowel sounds. Look, listen, feel. Listen to bowel sounds in all 4 quadrants. Get your towel. A little bit so I can see. Sure. Okay. Cover your patient. What I recommend is put your towel underneath. So if you spill, you spill on your towel and not on your patient. Your paperwork does not say you have to instill air prior to. You don't. That's either option. What you could do is you want to check residual. If it's clamped like this, let's say you have order to feed every 4 hours 1 can of Glucerna. The doctor wants 50 flush before and then 50 after. So if you want an order like that, then what you're going to do first is you want to clamp it. So you pinch it off because you don't want air to go into it, because if you open it and leave it air up, that's like you just breathing in air into your stomach, and it causes upset stomach and burps and indigestion. So you always clamp it first. You're going to pull out your gastric contents. What's the protocol for the hospital?
100.
Right. If it's greater than 100, then you would have to hold your feeding
1 hour.
Right, for 1 hour and recheck it. So then you would empty it out, or you would empty it out to measure it out. Pull more. And let's say I only got 20 more. A lot of times you'll meet resistance. One thing too, on PEG tubes and even on NG tubes, when you're checking for residual, sometimes they can, as you're pulling, it can stick to the stomach. So a lot of times you can either have a patient cough. You can, on an NG tube, you can just have them just turn their head, and it will release the tip. Same thing with the PEG tube. Let's say you're suctioning, you meet resistance, but you think, oh, the stomach's really distended. And so then you can move it around and pull different directions, or sometimes you would pull it back just a little bit to pulse it to let it go off of the stomach, and then you can pull it back and go around like that and pull until you meet resistance. Once you meet your resistance, clamp it, pull it back.
Does it smell in real life?
Sometimes, yeah. It's digested food. So if you wanted to order to flush with 30, let's say our order was 50, right? So you can use regular water, flush with 50, let it go, wait till it goes down to the very end here. Don't let it go to where it goes to where air hits it, and then clamp. And then if you have gastric contents measured out, and you always put it back in. Why do we put it back in?
Because it's already digested.
Right, it's partially digested. Because if you threw it away, then they have to start over from 0. And then you would pour that in, hold it up, let it go. If you have quite a bit, that's how we filled the rest of it up, clamp. And then you want to feed, you want to feed your formula, fill it up to about 2/3 here. Don't do it all the way because sometimes it can tip over. Hold it, and make sure that you hold both the syringe and the tube, because it will pop out sometimes. When you get close, clamp it, or you can just continue as you get close down, just continue to fill it until you do your whole can of Glucerna, and then afterwards rinse with your 50 of water. Hold it up. You can also, sometimes it's thick, so you can shake it a little bit. Now when they have medication, of course, they have to be crushed, both of these. And then when you get done flushing, pinch, put the top back on, and then you're finished.
Okay, yeah.
Thank you. So, yeah, it is. And then if it has a tube feeding, then you just connect the tube feeding back up. And whatever the rate is, so you chart just like a pump. What the formula is, what it's infusing at via pump to where. peg tube. Sometimes peg tubes will have a dressing on it, 4x4 or a drain dressing on it. Sometimes they're open. Then of course you're just going to always try about the insertion side. Sometimes they get red, especially they'll get kind of crusty. So you make sure that you clean them and everything.
So here's my question.
Uh-huh.
If they're on a continuous feed on a bag, would you normally have to stop and do a feeding? I mean,
No. If they're, this is just if they were just like ordered of a can.
Okay, so if it
Can
was
every 4 hours.
If it was a can every 4 hours, it would just be clamped
Clamped,
like this.
correct,
Okay.
yes. If it's a continuous feed, it will be like 25 cc's an hour, 35, 45.
And those would be replaced every 24 hours.
The bag will be replaced every 24 hours, but you have to still check residual every 4.
Okay.
Because you got to realize you're still putting fluid in there.
Mm-hmm.
And if you don't check it every 4 hours, then they can get full, and then if they vomit, you know,
Yeah.
they can't speak, they can aspirate. And then, you know, but you always reinstill the amount in if it's greater than over 100 that you clamp on it. These, like I said, I always, at the end when I'm done with these, and I have you guys do this, I have you leave them apart. You'll go and rinse them off, clean it. A lot of times you'll go into a room this already has water in it. You never use what's in here. Because how long it's been there?
Yeah.
It's been there all night long. So I have you all rinse it out, then put your saline in there or the fluid that you need. And then when you leave, now if you guys know that you're going to do it again, but it's okay if you leave a little bit there. But a lot of times I have you dump it out, pull it apart, let it dry, and then that way you're less likely to get contaminants and stuff like that in there. Yes.
When you flush it with water, does it need to be sterile water or can it be just regular tap water?
Depends on the facility. VA does tap water, hospital does sterile water, or normal saline.
So you would need, obviously this isn't enough water to do all your flushes. Do they have bigger bottles of
Yeah,
this?
they have a great big huge bottle.
Those liter bottles.
Yeah, and then and when you're pouring water in here, you don't have to fill it up. If you know you're only going to do 30 cc's of flush before and after, so you only need 60. So just pour a little bit till you think about 60.
Okay.
That way you don't waste so much.
Mhm.
And then of course once you get done, always do oral care both in an NG and a PEG tube. Make sure the bed's above 30 degrees.
How come you have to do oral care with the peg tube? In case they vomit?
Because they're NPO, they don't eat,
Oh,
and they're
okay.
NPO. Majority of the time they're NPO.
Okay.
Now there will be times though when a PEG tube and NG tube, like when they're getting ready and they're seeing how they're tolerating things, that they'll be allowed to eat. Cause like my aunt had a PEG tube because for a period of time she would eat and then they put a PEG tube, but then she would eat meals. So that she had her orders for the family was if she'd only ate like half a meal or less, and we had to give her a can of supplement too.
Okay.
So it just all depends on
The
what the
orders.
yeah. But normally they're NPO,
Okay.
and then sometimes they'll have like ice chips or water. And of course, like you clean them up, bed low, call iron reach, safety, document same thing, how they tolerated, how much the residual was, the consistency, the color, and how they tolerate procedure and what the site looks like. Okay. Any other questions?
Easy. Hopefully. I've seen worse checkoffs.
Where do you want me to put this? Your office?
Yeah, oh, yeah, I can get the little pack back on there. Well, see, the good thing, hi!
Everybody's on it,
You
so
can take,